is increasing the number of people who have mental health problems. And as we all are aware, the unemployment, poverty, low socioeconomic status, all has a link with the mental and the physical health as well, both of them.
So you don't think there is actually anything new in this case, because as you said, it's typical for recession periods, for these kind of economical periods, to have workers having problem with alcoholism, addictions, as well as other mental health issues. Why? I mean, why do you think it's now a sort of, it became a sort of bigger issue? I don't know, but is there anything new actually? What do you think?
Well, I'm not sure is there anything new. I mean, this is, we all are aware. We expect really, you know, and we see it. That's you know, in day to day, my practice, I come across people who actually broke down because of the pressures, and the relationship broke down. Now, the issue which then arises is the cutbacks in the services because of the financial pressures. So what actually happens? General practitioners who are on the front are overwhelmed by people presenting with stress and anxiety and alcohol problems and drug. And there have been recent survey. I don't remember the full publication, but I have a recent survey of the general practitioners, and 80%, about 80% of GPs say there have been definitely increased number of people who are presented with anxiety and depression. And about 50% of those general practitioners feel that they find it very, very difficult to deal with the pressure themselves, because people present, they make a referral, and the secondary mental health services have criteria. They push the referral back to the general practitioner. So ultimately, those people really have to become worse in order to get help. So in my own view is that the general practitioners are the people that who are at the front and having all the pressure.
Yeah. So did you see in your patients an increase of mental health issues? Have you, I mean, did you see an increase of patients actually coming to you to speak with you?
So, I mean, I do a private practice. Obviously, I get people who are affording, you know, who can afford and come, who have insurance. But I also work part time in the National Health Service, and that's where I see the impact. That's where people actually present with housing problems and suicidality, and they get admitted to hospital, and they don't have a place to go back, so they just spend a lot of time in bed, you know, using a hospital bed, and this all results in pressure over the service overall, because you know, the hospital can't push them away and discharge them on the street. So yes, I have seen, and I've seen actually general practitioners saying that, please, you know, this particular patient needs help, but then, you know, those people, because there is a threshold, and until people actually come to that level, they are not accepted for help. So I think there is a lot of frustration that we, as a psychiatrist,
yeah. So you would say that because we all know that austerity measures are affecting more lower classes than upper class, this also means that the mental health issue affects more lower class than upper. Even though, I mean, if someone read the media, someone read the newspapers, or watch the television, you will see like a lot of these austerity suicides and linked to, I don't know, bankers committing suicide in the city, or this sort of.
Yeah, I mean, my own view is, in order to sort of understand that concept, there is a line of poverty below which is there is a poverty, and that line has gone, so the more and more people going below the poverty level, you know, in the poverty level. I mean, as we know about, I think say 1/4 of people are you know, have poverty really in this country, and 1/8 are unemployed really, you know. But the issue here is that more people are pushed down, so the number of people who are in poverty increase. Now, there are already a number of people who are in that line, in that area. They most probably have been there for whole their life, and perhaps, and we know that there is increased mental health use of mental health services, and you know, presence of mental and physical health in people with low socioeconomic status. So we know that they already have. But when there is a change from above to low, that hurts, and that is what makes those people more prone to get anxiety and depression. And mostly those are neurotic illnesses they get. So I think the change, it causes more problems. So everybody has changed, okay, everybody got the pressure, but I think if there is a more change, contrast, from a higher to suddenly lower, that affects the mind, because that is where there is a loss. And
yeah. What is the typical story that you have been listening to listening to your patients? What is there any typical, if you want, story?
Well, the typical story is there's a family, you know, children, and the man working in a warehouse, and I've just recently come across in one of the warehouse which became bankrupt and finished, electronic warehouse. And he then was made redundant. Okay, he couldn't deal with that. He tried to find the job. He started drinking alcohol because he was feeling stress from home, from children. And he was then kicked out by his wife. I mean, that's the typical. So he kicked out, then moving from one area within Sussex, and I worked in Sussex, to another area, a big city, living on the street, was put in a hostel where he tried to commit suicide and admitted to hospital. Now this is the typical story we come across. And then what we do is that we look at the number of losses, you know, the loss of job, loss of status, loss of relationship, loss of touch with children, and loss of home. And we as a services feel in some way not very competent to deal with it because we can't provide. And as in my view, that increases the risk of real suicide. And we know that 95% people who commit suicide have mental health problems. But then what is the definition of mental health problem? People who have a loss, they can't deal with it and they commit suicide. So my own view, observation is the suicide rate has increased. But obviously, we won't learn it until several years after that. So we'll get the data. We say, well, this is where the graph is going. So yes, this is the typical story we come across is this: a sort of middle-aged man losing a job, and then he is in an age like 40, 50, can't find a job, drinks alcohol, and kicked out by wife because he's behaving bad because of alcohol, and then living in a hostel admitted. So this is the typical story.
Do you have patients that are still have a job, and in that case, because I heard that one of the problems is the pressure at work, because of course austerity is hitting everyone, from the workers to their employers, and employers are kind of putting pressure on workers. And for example, they cut their hobbies or other physical activities, and they sort of became only focused on their job, and that's it. Is that a sort of a story that you have been hearing?
Yeah, that sort of people I see in private practice as well. Those are people who are working in a big companies, banks in London, and they have been put under more pressure. Certain centers or offices or head offices closed and moved to other countries. I mean, recently I saw one of patient whose office has been moved to Holland, and she will be displaced. Everybody, children and husband and all the complication within the family then result. So, so there is first of all there is increased pressure at work. They work more hours. Okay, interpersonal relationship within the workplace have become disturbed because everybody is under stress. So there is more chance of people blaming each other, and this results in really either a sick leave. So this has been definitely increased sick leave. I've seen a number of people who actually can't cope with the job, and they because of stress or burnout really, and they can't work for a while. And the cost of that, imagine, is a lot. They're covered by insurance companies, they whatever, but they can't go for weeks. And so this is I fully agree with you. This is the issue which is there in people who are working, who haven't lost the job but who are undergoing a lot of stress.
This I was reading before a report done by Mental Health Foundation, and I think the thing is linked with what you were saying before. This report showed that 60% of GPs said that they don't have treatment to deal with the problem of mental health issues, and 95% need longer appointments. What does that mean?
Yes, typically a general practitioner slot of seeing a patient is about 15 minutes. Yeah. And in about 5 minutes, they have to look at the record, and get to sort of know previously or write prescription. It's only about 5-10 minutes left for them to talk to patients, see patients. And what happens if people are distressed and they're suffering from anxiety and depression, they need somebody sympathetic to talk to them. Okay? And they come to the doctor as a first sort of point where they expect the GP would listen. The issue is the GP is thinking about number of patients they have to see in a short period. So they are pushed, and they have to book sometimes double appointment, but it doesn't work because so much pressure. So they often end up saying patient, right, okay, well, I will refer you to the CBT, which they have some CBT counselors working with them. There's a long waiting list for that, which is increasing. If you look at the psychological services with the GP, there is a long waiting list now. And so GPs do need more time, but then at what cost? They also need to see people who are who are physically unwell as well. So I think I certainly agree with the GPs that they need more time, but can they provide that? That's the question.
I mean, another effect that I've been reading is that doctors, GPs, and even like psychiatrists, psychologists, they're sort of pushed to become managers in hospitals and to assess, to do risk assessments, and all this thing is because of reducing costs in health. And do you think that we are going to end up privatizing health? Especially, I mean, in this case, we're dealing with mental health issues.
I mean, that's a very difficult question, and you're talking about National Health Service's future. The issue here is that to privatize mean that it won't be National Health Service. So we have to change its name, and I really don't think that politically somebody could be that brave to do that. There is a need of more funding. Funding has been cut, and there are more demands as well. There are more expectations and less funding. And I think there is a need of some action, but who will take it?
Because I mean, you said you work both as a private psychiatrist and as well in NHS. I've been talking to charities that deal with mental health issues. I've been talking to Young Minds and other associations and charities that help people struggling with. And I've been seeing also like these sort of projects, houses that have been closed who were giving home to people with mental health issues that can't afford sort of private psychiatrist. And this, all these, I mean, when austerity hits, it hits these public sort of public network of support, if you want. So the next step, I think, logically will be like, I don't know, it really looks like they're trying like to privatize, or at least to make sure that only private help can be possible.
Well, I think I mean, who would afford private help? And people have been diverted to private, but obviously private comes with a cost, and who will bear the cost? So I think the ultimate question is about the funding and how to prevent mental health problems, and that's where the austerity and all that come, the whole culture and the class and the pressure within society. So I'm not sure whether I understood your question very well, but I think obviously people need help and people need a service, and whether it's provided with private or national service, the issue is really how to set this up.
Would you say, to put it more simply than before, that are they spending money on NHS, or they're cutting?
Well, they have been cutting, and there have been more pressure to cut.
Yeah.
And that cutting is affecting the service. There have been cuts in the service, and it is affecting the staff because staff are having more pressure. So yes, there is a cutback and pressures to cut more in order to survive, because these are foundation trusts. They are independently managed, and they're managed as a business. So if you can't manage them, then the risk is that you will be taken over, and the chief executive and the board is going to put their hands up, and they don't want to do it. So they're cutting the service, they're cutting the various services. But the problem is that when they cut, do they actually can they actually tell we are cutting because of that? Is it acceptable that say, well, we can't provide it? Yeah. Is it acceptable to say we can't cope with it? Because this is not acceptable, in my view, the various words and various management tricks are played in order to find the way to cut the money. So which does come to the question, do we need to be sincere? Are we sincere? And do we need to really open and be less diplomatic and tell everybody that what is happening, so that at least it's more acceptable, rather than a sort of conspiracy or not having a trust?
I think we're done.
All right.
Thank you very much.